Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. The Honorable Professor Dr. Insinyur Ilah Sailah, MS, as a Rector of Binawan University, the Honorable Mrs. Dr. Mia Srimiati, SGZ, M.Si, as a Dean of the Faculty of Health Science and Technology, the friends who have been present at today's event. Ladies and gentlemen, I'd like to introduce myself. My name is Khanifa Ghina Fauziyyah as a student of Nutrition Study Program at Binawan University. It's a to be your master of ceremony on this very special occasion. First of all, let us pray and praises to Allah Subhanahu wa Ta'ala. Because of His blessing and mercy, we can come together without any obstacle here. With healthy condition in the event of Health Scientific Update. We would like to say thank you and welcome to the participants in today's event. On this nice occasion, let me deliver the structure of the event today. Ladies and gentlemen, now we come into the main point of Health Scientific Update, which will be delivered by Mrs. Dr. Sandra Hakiem Afrizal, M.Si. But before that, I would like to read the CV of Mrs. Sandra. She is a lecturer of Nutrition Department at Binawan University. She received a bachelor degree in Faculty of Medical from University of Sumatera Utara. She received master degree in Applied Microbiology from University of Indonesia. And also, she received doctoral degree in health science from University of Indonesia. Now, she is going to share the material about effect of dietary fiber on blood pressure of hypertensive patients. All right, to Mrs. Sandra, did you connect with us?
Yeah. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Khanifa.
All right. So, Mrs. Sandra, time and place are yours.
Okay, I try to share my screen first. Can you see my screen?
Yes, Dr. Sandra.
I think I should Okay, but this one is, I think, for slideshow. Okay, can you see all the screen?
Yes, of course.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, my students. Yeah, I think most of you are my students, and some are my colleague in nutrition study program. So good afternoon, and thank you for giving me a great opportunity to be a speaker. Yeah. Well, actually, we will do a discussion. Yeah, instead of giving a lecture, and also sharing some experiences, but of course related to the article that I'll be reviewed. Okay, my name is Sandra Hakiem Afrizal, or you can call me Bu Sandra, or yeah, Bu Sandra. Yeah, in this session, I'll try to give like some comments, yeah, to an article which published in accredited journal Sinta 4, yeah, which entitled pengaruh pengaruh diet tinggi serat terhadap tekanan darah pada penderita hipertensi, ya. So this is a journal ilmu keperawatan dan kebidanan from Universitas Muhammadiyah Kediri, if I'm not mistaken. Okay. So actually, I'll give my review to this journal. So I hope all my students can learn from this simple review, so that when you try to write an article or you want to try to publish your paper, then you will not have any difficulties, I hope, inshallah. So today, the outline of my presentation is to start with to review the abstract, review the introduction, and followed by literature study, methods, result, discussion, and conclusion. So, okay, I'll try to start with the abstract first. So the abstract should summarize research background. Yeah, what is research background? Background is a reason of the writer choosing the topic. So the topic is the important issue currently, and the number of the highlight issue is still high in the community. So, and the important things is the authors find the lack of research or guidance or techniques discussing the topic. That is your very strong background. Yeah. So in this first sentence, first, second, or third sentences in the abstract will consist of these three things. Yeah. And the second part of the abstract is research objective. And the common words used for the research objectives are to describe, to explain, to compare in English, to identify, to measure, to evaluate, to develop, to explore, to observe. Or in Indonesia, you can use mendeskripsikan, menjelaskan, membandingkan, mengidentifikasi, mengukur, mengevaluasi, mengembangkan, menyusunkan, menyusun, menetapkan, menilai, but not to avoid to analyze, mengetahui. I think this is not so what we call it, to never been used before, like to know, untuk mengetahui. I think untuk mengetahui is too general. And method in abstract, you should also put methods, result, conclusion, implication, and the keyword. So what happened to the paper? We can see here, okay, from latar belakang, the authors put the hipertensi merupakan penyakit yang tidak dapat disembuhkan, tapi dapat dikontrol, and so on and so on. Oleh karena itu dibutuhkan upaya melakukan pengobatan secara non-farmakologis. So actually, the main point is from the title we can see the main topic of this research is non-pharmacology medication for hypertensive patient. So you can put the main topic in the beginning of the sentence. And the second one is tujuan. Here the authors write mengetahui, yeah, as we know in the my previous slide, you know that mengetahui is not kind of usual words for the objective of the study. Yeah, kalau kita, if we translate it into the English, to know, yeah, I think there is no such word in publication, yeah, in the journal. So we can change the aim of the study. And the methodology of the research is quasi-experiment, and this is, I think, the authors did typo here, quasi-experiment using I instead of Y, yeah, and analysis using UGT independent and so on. Yeah, I think I will try to make my own what do you call that, small revision. You can see here saat ini pemanfaatan metode non-farmakologi untuk pencegahan manajemen penyakit hipertensi berkembang sangat cepat. Salah satunya adalah pada makanan tinggi serat. And you give the what we call the name of the dietary fiber. So you can specifically put the name into the abstract. Yeah. And you can follow the sentence with the lack of research related to the study, and so the aim of this study is to I think I will try to make the slide here. Okay, so this is the objective of the study, is to menilai perbedaan rata-rata. It's different, right? Before the author said mengetahui pengaruh, and I change into the menilai perbedaan rata-rata. Then I will explain it later. Yeah? This is related to the research methodology. So and I change the how to present the research methodology and how to present the result. Yeah? So actually a lot of what we call it. Yeah, I think I will leave some comments for the abstract, and I think abstract is too general. It should explain the main topic at the beginning. Yeah, you can see I changed the the sequence of the background, yeah, and explain the aims of the brief sentence. Yeah. No need to put places specifically in the aims of the study. Yeah, we just write the brief in a brief sentence, preferably one sentence. Yeah, it's enough. In methodology, how many fiber intake is unclear. What kind of fiber is also unclear. So you have to mention how many and how long. Yeah? What kind of the fiber did the the respondents take. Yeah? And dependent t-test is not for positive or assess the influence, atau not for the pengaruh one. You know, the previously we can see from the abstract, the aim of the study is mengetahui pengaruh. So pengaruh is is more to causative or assess the influence. But in analysis, the author used dependency test, which is more to find the difference or correlation. So it's too different from the statistical analysis and the aim of the study. So you have to highlight this abstract. Okay, and the second part is I want to review the introduction. So in brief, introduction describe the topic setting in general, and paragraph are built by facts. Why does the topic become a problem? So this is a research gap, and reason why the research is important and interesting to be disseminated. And what is the research implication, contribution to the knowledge and the theory. And also sometimes several journals ask for the research question in the end part of the introduction, but some of journals not ask for that. So before you submit the paper to the journal, you have to read carefully the requirement from the journal. So, okay, I try to go through to the introduction. So here we can see all of the paragraphs explain about the hypertension. So here, hipertensi merupakan salah satu penyebabnya. And I think most of the paragraph telling us about the hypertension, but only less information we can read here about the high fiber diet. So that I try to what we call that, to modify the introduction with this idea. High fiber diet is recommended by FDA or whatsoever for non-communicable diseases such as hypertension, and you can add several sentences regarding to the main idea. And after the first paragraph, usually we put previous research related to the first topic. So after you get all the research and you can find a research gap from the previous research with unable to explain a specific issue about the high fiber diet and the blood pressure. What kind of specific issue that other people never thought before? So you can take it as a research gap, or this is the novelty of your research. So, and from the end of the introduction, we can try to build the research question. What is the difference in the blood pressure towards kind of dietary fiber intake? I mean, kind of dietary fiber intake, just like oatmeal, dietary intake, and low dietary fiber intake. You can put the research question like that. So I have several comments for the introduction, but actually the authors not only explain about the hypertension, only limited information explaining about the dietary fiber related to the blood pressure. So not clearly state the research gaps, what previous research fails to answer. So actually, this is a very interesting research if the authors give what we call valuable information to the introduction. So the readers, the readers like me and all of you here can see what the research will bring, the value added of the research. Okay. And okay, the third part is the literature study, which explain the theory, regulation, which related to the study, explain the evidence related to the topic. And this part, we can create subtopics. Yeah? And end of the literature study, we can get the theoretical framework based on the literature. And what can we see here in the landasan theory of this paper? The authors put too many theoretical about the hypertension. I think this one is too, not putting the evidence, but put the theory instead of the evidence. So I think I suggest, to, if you write the studi kepustakaan or whatsoever for your skripsi, and for your thesis, so you can actually write the subtopic. Subtopic. You can put the angka kejadian hipertensi dari berbagai etnis di Indonesia. You can put the subtopic title just like this. Then you can explain hipertensi adalah keadaan lalala, and then in the second paragraph you try to find evidence about the incidence of hypertension in Indonesia. Yeah.
Sorry, Mrs. Sandra.
Yeah. Sorry.
The PowerPoint is not slideshow.
Oh, not slideshow.
Yes.
Sorry, I didn't change anything. Okay, I try to stop my PowerPoint first. Okay. Okay, I try to start with the PowerPoint. How about now?
Not yet, Miss. Not yet, Miss.
Oh, okay. What happened? Okay.
Nah, itu udah. Tapi jadi gede banget.
How about this one?
Not yet, Miss. Belum di. Yes. All right.
Okay.
Here is.
Oh, but it's too big, huh? It's too... Okay. So, where did we go? Okay, I think, yeah. So, to write the landasan theory or literature review, literature study, you can write just like this, ya. Angka kejadian hipertensi from the berbagai etnis di Indonesia, or variasi makanan tinggi serat, manfaat makanan tinggi serat, ya. So you don't need to write all the everything here, and I think the reader doesn't need the information. They more need the evidence about the hypertension and also the variety of the dietary fiber. So what my comment for the studi literature or literature study, I think this is too lengthy. You can see from the paper, I think the authors had 2 pages just only for the literature study compared to the result and discussion, which is only 1 page. The authors put research variable in the landasan theory. Actually, we can find the research variable not in the landasan theory, but after the landasan kepustakaan, yaitu teori atau studi kepustakaan. After you make the studi kepustakaan, then you will get what is your research variable, and too much theory but less evidence. I can say like that, to the tulisan, and lack of research framework and conceptual framework. You can assess the paper, and you can see there is no research framework or conceptual framework, which is important for the authors. Important to the reader to easily find which variable in the research. So we can move to the methodology. I think I need to be more fast to explain. And methodology is a detailed description of the research process you use to support your findings, and explain your technique and create roadmap for how you reach your conclusion. And sometimes we need to restate the research problem, but sometimes not necessarily do. What kind of approach has been used, and why you choose this approach, and explain how to collect the data, research settings, participant, etc. And explain how to analyze the data based on the research question or based on the objective of the research. So in this research, well, actually, I think many information that the authors do not need to explain, such as the langkah pengumpulan data. This is not so important to explain here. Just you can not to include this information in your paper. And metode pengumpulan data is, I think, it's not too detailed, explaining how the authors get the data. So my comment for the methodology, actually, a bit. I think I have many comments. The methodology should provide study protocol, not research steps. It's clearly, the study protocol should clearly explain in the methodology. So we can see here how to recruit the participants, the study protocol. So the how to recruit the participant is still unclear in this study. How long the study will conducted. Actually, they already explained that this study only 6 days, if I'm not mistaken, and not provide information about the informed consent, number of approval or ethical clearance is also not available. No explanation about the eligibility, or the inclusion or exclusion criteria for the participants. But in my suggestion, to reduce the what we call that bias, bias to the research, I think the authors need to choose the newly diagnosed hypertension without medication and make the baseline blood pressure more than 130 for systolic, based on the theory, and 80 more than 80 for diastolic. And a lack of instruction for participants. The authors did not mention any instruction for the participants. For example, how many food that they need to consume, when they need to consume the dietary fiber. And also here they do not explain about the blind examination explanation. Actually, blind examination will increase trustworthiness, kepercayaan, kepercayaan from the reader, and also avoid bias. And when the lack of information of when to measure the blood pressure, morning or afternoon. So it's need to consistent. Consistency is important for the experimental research. And using what kind of blood pressure machine, sphygmomanometer, manual or electronic, diameter of the cuff, cuff itu something that put in your lengan. How many measurement in observation, for to read the blood pressure. If 2 times, you need to take the mean, rata-rata from the blood pressure. In the first take and second take, you can calculate and you take the mean. Okay, from the result and discussion, actually we need to presenting the findings by using the data analysis. You can take the data analysis and you present the findings using what support you and what we call bertolak belakang with your findings. You can discuss in short summary of the main findings and elaborate it to identify the contribution. You can use previous research to support your findings. And so in this result and discussion, the authors only state the result in a very short statement. Hasil analisa menunjukkan ada pengaruh dengan nilai signifikan dengan P 0.0 and penurunan nilai rata-rata from 158 into 143. And I think it's not it's not enough to explain what kind of phenomena here. So I think you can put another observation from your research to support the result. Okay. And I think we can state in the last paragraph, from the practical standpoint, improvement in systolic blood pressure and diastolic blood pressure, such those observed in this study would be useful contribution to the clinical management of hypertension. I think this statement is important to give reader what we call that reader information, give the valuable information about your research. And the last part, conclusion. However, this research lack of conclusion. We cannot find the conclusion from this paper. However, conclusion need to answer the research questions and fulfill the research gap, and relate to the aims of the study, and avoid using points. In an article, I think they use a paragraph instead of using points. Nah, okay, from the reference, okay, I think I try to review these references that the authors have. So from the reference, I think this paper actually published in 2022. So it means that this year paper, but however, we can see these very obsolete references, 2005, 2010, most of the references is more than 5 years, and I think preferably choose to the latest references, and choose articles, instead of books, Kalau bisa menggunakan articles dibandingkan menggunakan buku, so choose the latest references and follow the journal instruction, which style to be applied, and use reference manager. It is mandatory. I think not all, most of the journal asking about the reference manager. You can use Mendeley, or yang the free one, or I not so familiar with Zotero, if I'm not mistaken, the name, and not on others, But for me, personally, I will choose Mendeley because it's easier to use. Okay, I think that's all my presentation, and I'll give back to the M.Si. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thanks to Mrs. Dr. Sandra Hakiem Afrizal, M.Si, for the knowledge which have been given to us. May it useful for us. All right. The conclusion about the material is hypertension is a disease that cannot be cured but can be controlled. It requires patience and a fairly expensive cost. Therefore, efforts are needed to carry out non-pharmacological treatment, one of which is high-fiber diet therapy. Someone who eats a low diet fiber generally has blood pressure who is higher than someone who eats a higher fiber diet. Substitution from low fiber diet to high fiber diet can lower blood pressure. High blood pressure is synonymous with fat. To prevent this disease, the presence of fat in the body must be reduced. Most of the triggering causes the ring is blood pressure comes from improper food intake. Should be given attention to how body remove excess fat. So, high fiber diet is recommended by FDA for non-communicable disease. Reminder for the participants can fill attendance link in the chat box at the end of event. All right, the next one is a question and answer session. Okay, here a question from the panelist one, that is Nur Addiniawati. Please turn on the camera and microphone, and then you can start to ask our speaker. To Nur Addiniawati, did you connect with us?
Yes, again.
All right.
Okay.
And place are yours.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. I'm Addiniawati. I would like to ask about this. If hypertensive patient consume excessive fiber, it is likely that it will cause certain side effects or might even cause complication. Is there a limit to amount of fiber consumed per day for hypertensive patient? Then
All right, thank you to Nur Addiniawati, to Mrs. Sandra, the time to answer the question.
Okay, thank you, Nur Addiniawati. I will try to answer your question, yeah, about the excessive dietary intake. Yeah, actually something that berlebihan or too much. Yeah, I think it's not good. Yeah, for everything. Yeah? Everything in too much amount will not get the good output. Yeah, now including to the dietary fiber, as it is what we call it a complex carbohydrate. Yeah. Yeah, actually the dietary fiber is a complex carbohydrate. So if we consume the dietary fiber in excessive amount, so the certain population of the fiber digesting gut bacteria, yeah. So the bacteria which digest the fiber will increase, yeah, the population, yeah, increase the population, which produce gas as the end of product of their metabolism. Yeah? So you can for people which too much dietary fiber intake, so they will feel bloated, yeah, kembung, and flatulence. Yeah, flatulence means that sering kentut, yeah, flatulence, and abdominal discomfort, yeah, because of the gas producing by the bacteria. And the complex carbohydrate is also may slower the gut movement, ya. Jadi pergerakan usus will become slow, and it will increase the size of the feces, ya, di kotoran, ya, ukurannya menjadi lebih besar, ya, karena dia pelan, and of course, because of the slower of the movement, will increase the absorption of the water, and increase the potency to the intestinal obstruction because of the hard feces, ya, hard fecal. We call it kotoran yang keras. Yeah, that's the what we call that the side effect of the dietary fiber. So because of that, the authors, yeah, for this research, the authors did not mention about how many or how much the dietary fiber the participant took, yeah, in this research. So I think the recommendation for this research, they need to put the amount of the dietary fiber that which can lower the blood pressure. Yeah. I think that's all my answer.
Thank you, Mrs. Sandra, to the great answer. So Nur Addiniawati, how about the answer?
okay, I think it's enough again. And thank you for Miss Sandra.
All right. Okay. The next question from the panelist two, that is Mrs. Sri Ardianti Khasanah. Please turn on the camera and microphone, and then you can start to ask our speaker. To Mrs. Sri Ardianti Khasanah, did you connect with us?
Okay. Can you hear me clearly?
Yes, of course, Miss.
Okay, thank you for the opportunity. Hi, Bu Sandra. Okay, I think this study is interesting. Usually, to treat hypertension, the nutritionist or dietitian using low contain sodium food. But in this study, the author emphasize the consumption of fiber to reduce the blood pressure. Okay. Related to the journal review, what kind of research method for intervention study that is compatible to be conducted by the university student, especially for clinical research similar to the study? Okay.
Okay, thank you, Bu Anti, for the interesting questions. Yeah. I think in my suggestion, I think all of my students can do this such of work, but what you need to do is you have to increase the main point is to increase the validity of the research. Yeah, and you try to avoid the bias. Yeah, try to avoid the bias. We can do the similar study, but we can change the probably the research research analysis or research techniques. Yeah, we can choose randomization. Yeah, using blind sampling. Yeah, and I think we can get collaboration to the puskesmas. Yeah, and in this research they use hypertensive patient which already consumed the hypertensive drugs before. So I think the bias is too high. Yeah, we do not know either the lower blood pressure caused by the medication or caused by the dietary fiber. So you can conduct another research by selecting the technique. Yeah, you can use the careful. I mean not careful. Yeah, you can carefully choose the research protocol. Yeah, and you can choose also the control groups. Yeah, and you can also change the analysis into the regression analysis to get what we call that. Yeah, untuk pengaruh ya. We know the effect using the regression analysis compared to the t-test ya. Kalau tadi t-test is too sangat sederhana, the simple one, but using the linear regression, we can see the power of the research. Yeah, you can see the power of the your hypothesis. Yeah? So I think I very I trust that my students can do this kind of research in our university and get the publication, international publication, not only Sinta 4. Okay. Thank you, Bu Anti.
All right. Thank you, Mrs. Sandra, to the great answer. To Mrs. Ardianti Khasanah, how about the answer?
Okay, thank you for the great answer, Bu Sandra. I think enough. I return to MC Ghina.
All right. All right. This is the end of question and answer session from the two panelists. Thanks to the audience that had participated actively. Before we going to end this event, the participants can fill attendance link in the chat box. All right. Last but not least, we take a photo together. For all the participants here, please turn on the camera.
Okay.
All right. Are you ready? Let's take a picture from the slide 1. 1, 2, 3. Slide 2. 1, 2, 3. Slide 3. 1, 2, 3. And the last one. 1, 2, 3. Finally, we get to the last session in this event, that is closing. Let's close this event by saying Hamdalah, Alhamdulillah. As the master of ceremony, I would like to say thanks to the participants for attending today's event. If in guiding this event I made mistakes, please forgive me. We look forward to seeing you on the next event. Stay healthy and see you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Khanifa, Bu Anti, Christy, and all my students. Thank you.